Hi and good day. Chronic texting, being on a computer, sitting down long periods of time, slouching forward, rounded shoulders, that is the key component we're going to focus on today. Realize that when you're focusing downwards, the muscles, the musculoskeletal system is under a tremendous amount of load and stress. Remember, your head weighs 12 pounds. For every inch you go forward, that's an additional 10 pounds. So 2 inches is going to be 32 pounds, 3 inches forward, 42 pounds of stress that the muscles, ligaments, tendons have to hold up behind the shoulder and neck region. Realize that these areas are becoming weakened, they're becoming inflamed, and your body is going through the least resistance of changing, deformation of poor posture where the curve is starting to reverse of the normal neck. The curve is becoming straightened, what we call a military neck, because our head is in this position. Our shoulders are rounded, causing the chest muscles to contract and shorten. When these muscles shorten, they will constrict, affecting a very important plexus. This is the brachial plexus, the group of nerve that's running down the shoulder into the arm. Comes out underneath the pec minor. It affects compression on that nerve, causing pain, numbness, tingling, all the way down the shoulder, into the arm, into the hand, and fingers. Now, this is a chronic problem because of poor posture. So today, I'm going to show you some excellent exercises and stretches that you can do at home to hopefully combat this problem, to prevent those muscles from excessively contracting and clamping down on the nerve, causing the pain that you're having. Now, when you get compression in here, you can have referred pain to all areas within the neck, the mid-back, even into the chest, as well as we said, down the arm, into the hand and fingers. So these 4 exercises I'm about to show you are the ones you need to focus on to release that pec minor. The chest muscles are shortened. We need to stretch open those chest muscles, and we need to also strengthen those rhomboid muscles. The rhomboid muscles between the shoulder blades, which you can do by looking at my videos on this channel. But most important for our reference today, we're talking about stretching the pec minor to get pressure off the neurovascular bundle, off the nerves that's causing all that pain and discomfort because of that rounded shoulder, shortened contracted pecs, and poor posture. Okay, I have our great therapist Aaron here, and he's going to demonstrate these exercises for us. First, as we do the door stretch for the pectoralis minor, we're going to keep his elbows at 90 degrees, both of his elbows at 90 degrees. You can see facing upwards. We have it pretty much parallel with his shoulder. Now Aaron's going to lean forward. As he leans forward, he's going to hold that stretch. You can see how it's opening up, how all that is opening up in the pectoralis region and chest area. Now I'm going to ask Aaron to bring his arms a little higher up. And now I'm going to have him lean forward again. As he leans forward, we're actually stretching a different angle of the pec minor as well as the pec major. And then we'll have him bring his arms lower as we can get a different angle to actually stretch that muscle, to reduce that contracted muscle and hopefully take care of a lot of that nerve pressure that you're getting under that pec minor area. Now this wall stretch is an excellent stretch that Aaron's going to perform. We're going to stand with our back against the wall. Place your arms against the wall so that the back of your hands touch the wall and are at the same height as your head. Now in this position, your elbows should be bent and held to about 6 inches away from your waist. You want to raise your arms up above your head as far as you can. As you reach up, keeping your back and your arms against the wall. Very important to keep the back of your arms and back against the wall. As you raise your arms, push your shoulder blades into the wall, pause at the top, and then lower yourself back down to that starting position. Good. As you lower yourself down, keep the back against the wall in your arms, and you're going to actually do that about 12 times or so, and that will actually stretch the pectoralis minor, the pectoralis major, as well as the subscapularis muscles. Next is the Tao Chest Stretch. Excellent stretch to help release that pec minor, release those chest muscles that are actually contracting and causing that compression along those nerves that are possibly giving you a lot of pain. For this stretch, obviously you'll need a towel at least 3 feet long. You want to start with your arms hanging down at your sides. You're going to grasp the ends of the towel with your hands. You're going to raise your arms over your head, while keeping the towel taut, nice and tight. Stretch your arms behind your head as far as you can and reach and pull those ends as you're pulling it away from one another. At this point, the towel should be directly behind your head, and you should feel as if you have like a V position, just like that. See the V position in his arms? That's how you know you're doing it correctly. You'll hold this position about 20 to 30 seconds, and you'll do that 3 times. That will stretch those muscles that are causing compression in that region. Okay, this next exercise, we're going to extend the shoulders back. You can call it shoulder extensor. You can call it extensor of the shoulders. But as we bring the shoulders back, we're going to stretch those pec minor, pec major muscle. And this is a great stretch you can do by yourself. But if you have a partner, and I'm with Aaron to show you how we can get the full benefit of this stretch, to get that maximum change to release that contracted muscle or muscles that are taking place in the pectoralis region. First, we'll keep his arms obviously together, apart, but actually behind him like this. But we're going to bring them together with the hands. You see how his hands are clasped together here, just like you're clasping your hands together. Now what you want to do here is you're going to extend the arms straight up. And as he extends straight up, he's going to kind of lift up. Now, you may not be able to go so far, which is okay, but you'll feel the chest start to stretch. But I want him to straighten the back out, extend back again. Okay, you'll feel when you stand up straighter, you get more of a stretch. Now, you get more of a stretch if you look up into the ceiling. If you look up to the ceiling, he can come a little bit further back. Now, the partner stand about right behind him like I am. And then what I'll do is I'll bring his hands together and I'll bring it up a little higher. Not too much, just enough. Do you feel that burn, Aaron? Yes. To where you feel that burn. Hold it about 20-30 seconds and do that stretch 3 times. So you have great exercises and stretches to do. I want you to put these to work. It will make a tremendous change in your health. Remember, the pec minor, when contracted from poor posture, pronated shoulders, and all this forward head posture you're putting your body through day after day, texting on the computer, you need to stop. Get a lumbar support pillow behind your lower back. Take more breaks, change positions, and do these stretches. It will help you tremendously with your health, your pain, and your suffering. Remember, many of these conditions like herniated discs, bulging discs, and disc pathology, you may have it from an MRI, you may see it on a test, but most of the time it's coming from these sources, these weakened muscles, the nerves that are being inflamed and irritated from poor posture. Leave your questions below. You know how to reach me. Subscribe, please, if you haven't. And most important, make it a great day. I'm Dr. Alan Mandell.